Good morning, everyone. I am so pleased to be one of the participants in the 10th Scientific Conference Current Challenge and Updates in Pharmacy Education and Research of College of Pharmacy, University of Baghdad. First of all, I am Ibrahim master student, and my supervisor is Dr. Muhammad Yawaz in Department of Clinical Pharmacy, College of Pharmacy, University of Baghdad, and my research is about assessment of Iraqi physicians' adherence to medical guidelines in treatment of different diseases. Introduction. The guidelines are defined as a systematically developed statement to assist practitioners and patients in making decisions on appropriate health care for a specific circumstance. The guideline is a reasonable use for current best evidence in making decisions regarding the care of individual patients. The latest definitions also include the integration of best research evidence with clinical experience and patient values. The movement toward guideline has been gaining ground quickly over the past years, as it is propelled by clinicians and organizations who are concerned about quality, consistency, and cost. The guideline is geared toward the reduction of clinical practice variation and the promotion of improved patient care. Aim of this study to explore the adherence of Iraqi physicians to implement guideline in treatment approach, to know which guideline is applied in the treatment approach of different diseases, to assess the extent of awareness of permanent residents and clinical pharmacists about guidelines. Method of this study. This qualitative research was done in public hospital with different specialists, seniors, permanent rotators, and clinical pharmacists working in public healthcare settings using purposive sampling, also known as judgment selective or subjective sampling. Select a different branch and make interviews with specialists in each branch. Select 2 common diseases in each branch and ask specialists many questions according to question list. Sample size about 5 to 7 specialists from each branch, 4 physicians from each discipline, which is mean 32, and the same number of clinical pharmacists in this watch. The interview will be stopped after reaching the saturation point. No more new data collected. One-to-one in-person interviews for 5 to 15 minutes. Result from this study was that the results from this research were that there is no standard Iraqi medical guideline followed by the physician in public hospital in the management of different diseases. The specialists follow different guidelines in the same hospital due to there aren't obligatory Iraqi guidelines from the Ministry of Health to be followed in the treatment approach. The seniors depend on guidelines that are easier for our society and their post-graduation study and flexibility of the guideline. There are many barriers, such as major barriers to the implementation and use of guidelines include a perception that guideline is more academic than practical, and clinicians cite their lack of guideline skills and a contributing factor, availability of treatment, investigation tools, patient education, patient compliance, follow-up, and deficiency of medical centers in implementation of guidelines in their treatment approach. Permanent and rotating physicians were mostly aware of treatment guidelines followed by the seniors, while most pharmacists were not aware of guidelines followed in the treatment management process. Finally, conclusion from this study was that the conclusion from this research is only 50 to 70% of guideline instruction applied by physicians in the public sector, while in the private sector range was that 82 to 90 due to flexibility available in the private. The only cost was the barrier. There wasn't a standard guideline in each hospital to be followed by seniors in each branch. There were deficiencies in tools that needed to apply guideline instruction in the treatment of many diseases. And finally, thank you.